Hello, everyone. Welcome back to another episode of Dr. Paul Podcast, where we answer your biggest pregnancy questions with simple, practical, and medically accurate advice. First of all, thank you so much for the incredible love and support you've shown the previous episode. I truly appreciate every comment, every question, and every message you've sent. It tells me that we're building a community where expecting mothers and families can learn, grow, and feel more confident throughout pregnancy. Now, in our last episode, we talked about labor, how to know when labor is starting, what contractions feel like, when to go to the hospital, and what you should expect as your body prepares for childbirth. Today, we're taking the next step in that journey. We're talking about delivery, the moment you've been waiting for. Should you have a natural birth or a C-section? Is an epidural safe? Will you tear? Can your partner stay with you? What happens immediately after your baby is born? And if you've had a previous C-section, can you still deliver vaginally? These are some of the most common questions pregnant women ask. And today, I'm going to answer each one in a simple, honest, and easy to understand way so you can feel more prepared and less anxious about your delivery. So grab a cup of tea, get comfortable, and let's get right into today's conversation. That's one of the biggest questions I get, and here's my answer. If you and your baby are healthy, a vaginal birth is usually the safest and quickest way to recover. But a C-section isn't a failure. It's simply another safe way to bring your baby into the world when it's medically needed. The goal isn't to prove how strong you are. The goal is a healthy mother and a healthy baby. So don't focus on the method, focus on the outcome. Trust your healthcare provider to recommend what's safest for your situation. A C-section becomes necessary when delivering vaginally could put the mother or baby at risk. For example, if the baby is in a breech position, the placenta is blocking the birth canal, labor isn't progressing, the baby is in distress, or there are certain medical conditions. Remember, a C-section is not a shortcut or a sign that you failed. It's a life-saving operation that has saved millions of mothers and babies around the world. Yes, for most women, an epidural is very safe and is one of the most effective ways to relieve labor pain. It numbs the lower part of your body while allowing you to stay awake and actively participate in your baby's birth. Like any medical procedure, there are some risks, but serious complications are uncommon. Talk with your doctor or anesthetist before labor so you understand whether it's the right option for you. It depends on how your labor is progressing and your hospital's policy. Many women can safely drink clear fluids during labor, and some with low-risk pregnancies may be allowed to eat light foods in early labor. However, if there's a chance you'll need an emergency C-section with anesthesia, your doctor may advise avoiding solid foods. So always follow the instructions of your healthcare team. They're thinking about your safety. In many hospitals, yes, and honestly, having someone you trust by your side can make a huge difference. A supportive partner can help you stay calm, encourage you, remind you to breathe, and provide emotional comfort during labor. Of course, hospital policies may vary, so check with your birth facility ahead of time so there are no surprises. Immediately after your baby is born, your healthcare team will make sure both of you are doing well. Your baby will be checked, and if everything is stable, we encourage skin-to-skin contact because it helps keep your baby warm, supports breastfeeding, and strengthens bonding. You'll also deliver the placenta, and your doctor or midwife will check for any bleeding or tears. The first few hours after birth are all about recovery, monitoring, and getting to know your new baby. Many women have some degree of tearing during vaginal birth, especially with their first baby. The good news is that most tears are small, heal well, and can be repaired if needed. Your healthcare team is trained to manage this, so don't let the fear of tearing make you panic. The body is incredibly designed to heal. You can't completely prevent tearing, but you can reduce the chances. During pregnancy, your provider may recommend perineal massage in the last few weeks if it's appropriate for you. During labor, controlled pushing and allowing the baby's head to come out slowly can also help. Listen carefully to your midwife or doctor during delivery. They'll guide you on when to push and when to slow down. Those instructions can make a real difference. Sometimes labor slows down or stops completely, and that's more common than many people think. Your healthcare team will first try to understand why. They may encourage you to change positions, walk if it's safe, empty your bladder, or they may use medication like oxytocin to strengthen contractions. If labor still doesn't progress or the baby shows signs of distress, a C-section may become the safest option. Every decision is made with one priority in mind: protecting both mother and baby. Yes, many women can. It's called a VBAC, which means vaginal birth after cesarean. Whether you're a good candidate depends on factors like the type of incision from your previous C-section, why you had it, your overall health, and how this pregnancy is progressing. Many women have successful VBACs, while others are safer with a repeat C-section. The best decision is one you make together with your obstetrician after carefully reviewing your medical history. Remember, it's never about proving anything, it's about choosing the safest way to welcome your baby into the world. I hope these answers have helped put your mind at ease. Pregnancy and childbirth can feel overwhelming, but the more you understand what's happening, the more confident you'll feel. Every pregnancy is unique, so never compare your journey to someone else's. Keep attending your antenatal appointments, ask questions, and don't be afraid to speak up about your concerns. Before you go, if you found today's episode helpful, don't forget to like this video, subscribe to the channel, and turn on the notification bell so you never miss our weekly pregnancy and motherhood conversations. If you're watching on Facebook or Instagram, be sure to follow this page and share this video with another expectant mother, a friend, or a family member who could benefit from this information. Until next time, take good care of yourself, take good care of your baby, and remember, a healthy, informed mother is one of the greatest gifts you can give your child. God bless you, and I'll see you in the next episode.